Are you having trouble breastfeeding your baby? In this video, I'm going to share with you the secrets of successful breastfeeding and how to position your baby correctly for a perfect latch. 1. What is the most important factor in successful breastfeeding? Positioning your baby correctly is the most important factor in successful breastfeeding. Proper positioning helps to ensure that your baby has a comfortable latch, takes in enough milk, and avoids common issues such as choking or gasiness. It also helps prevent sore nipples and other discomforts for both you and your baby. 2. What are some tips for positioning your baby to ensure a good latch? It is important to get your baby in the correct position so it can latch on and suck effectively. Here are some tips for proper positioning. Make sure the baby's tummy is facing the mom's tummy and that their head is close to her breast. Mom should hold her breast with one hand, supporting it from underneath and guiding it into baby's mouth. She should use her other hand to support the back of the baby's head or neck. The nipples should be pointing towards the roof of the baby's mouth rather than straight at them. If latching onto a large nipple, mom may need to compress her own nipple slightly to make it more manageable for baby. Make sure the baby's chin is touching mom's breast and their lower lip is curled outwards. If the baby is having difficulty latching on, use a finger to break suction first before trying again. Offer both breasts at each feeding so that baby can stay in proper position while they feed from one side, and switch sides if necessary. 3. What should I do if I am having trouble getting my baby to latch on? One common issue many mothers face is trouble getting the baby to latch on. If this happens, here are a few tips that can help. Make sure your baby's mouth covers a large portion of your breast, and that their nose is free from obstruction. Experiment with different positions to help get the best latch for your baby. Skin-to-skin contact helps create an instinctive connection between you and your little one, which may be beneficial in breastfeeding. Don't forget to relax. Stress can sometimes cause tension in our bodies, which makes it more difficult for our babies to latch properly. Take some deep breaths. Enjoy snuggling with your bundle of joy, and try again. If the latch is still not working, contact a lactation consultant who can help you find the best breastfeeding position and technique for you and your baby. With their help and support, you will be able to get back on track in no time. 4. Are there any exercises I can do to help with breastfeeding? Yes. There are some simple exercises that can help you to better position your baby for a successful breastfeeding experience. Here are some of the most effective ones. Neck tilt. When placing your baby on your breast, ensure that their neck is tilted back slightly. Doing this will give them more room to latch onto the nipple and create a wider opening for easier access. Chin in. Gently place your hand beneath your infant's chin. Then gently tuck his or her chin in towards the chest while they latch. This helps open up the mouth wider and aids with latching correctly. Cross crawl. Once your baby has latched properly, cross one arm over their body and the other under their body to support them. This helps keep your baby close to you and achieves a more comfortable latch. 5. Is there any advice you can give for breastfeeding in public? Breastfeeding in public can be intimidating for new moms, but with some preparation and practice it doesn't have to be. Here are some tips that might make breastfeeding in public easier. 1. Consider using a nursing cover or shawl while you feed your baby. This will give you a bit of privacy and help you feel more comfortable. 2. Find comfortable seating before beginning the feeding session. Choose a chair with armrests, if possible, so that you can easily lean back and relax while nursing without feeling exposed. 3. Wear clothing that is easy to open and close for quick access to the breast during feedings, such as button-down shirts or tops with zippers or snaps. 4. Research laws in your area that cover breastfeeding in public, so you know what to expect if you face any opposition or criticism. 5. Know your rights. There is a federal law that protects mothers who choose to breastfeed their babies in public, so be confident and ignore any negative comments or stares from strangers. 6. What are the benefits of breastfeeding for both me and my baby? Breastfeeding has many benefits for both you and your baby. Breast milk is the perfect form of nutrition for a baby, providing them with all the nutrients they need for healthy development. It also helps build immunity in babies, as breast milk contains antibodies that protect against infection and illness. For mothers, breastfeeding can help reduce postpartum bleeding, decrease risk of developing certain cancers, and promote bonding with their child. Breastfeeding can also be an economical choice, as it eliminates formula costs and can save money on healthcare expenses down the road. So not only does breastfeeding provide optimal nutrition for your baby, but it's also beneficial to both you and your wallet. 7. Are there any signs that I should be aware of that may indicate a problem with breastfeeding? Yes, there are a few signs that may indicate a problem with breastfeeding. If your baby is nursing inconsistently or not latching properly, if you experience sore or cracked nipples, if your baby has trouble staying awake during feeds, or if you have engorged breasts and/or mastitis, these can all be signs of an issue. It's important to talk to your doctor or lactation consultant as soon as possible so that they can help you make any necessary adjustments to ensure successful breastfeeding for both you and your baby. We hope this video has helped you unlock the secrets of breastfeeding and understand how to position your baby correctly. With these tips, we are sure that both mother and baby will be comfortable during feeding time. Don't forget to leave a comment or ask us any questions you may have about positioning for successful breastfeeding. If you like this video, please subscribe so that you can stay up to date with all our new videos coming soon. Thank you for watching and happy nursing.